Hi, everyone. It's Maura Sullivan. I'm the Director of Government Affairs and Health Policy for the ARC of Massachusetts. And I want to thank everyone who came on my webinar today at noon to hear a little bit more about the governor's FY25 budget that invested significantly in our workforce, Chapter 257, as well as some really wonderful investments in DDS, Department of Developmental Services. So I am actually going to do a recap right now in case you missed it. So bear with me while I share my screen. So I just wanted to start by actually thanking everyone for participating in the action alert that went out to the governor. We received over 1,400 letters that went directly to Governor Healey. And the letters really alerted her to the crisis that we were still facing, the thousands of people that are still unserved. The suffering, we noted the Boston Globe article about the challenges in our residential group homes. And prior to that, the ARC had sent a much more detailed letter, really trying to educate and make her aware of really all of the complex issues that are happening for families at home and individuals who are not being served. So together, I think we made a huge impact, and now we get to talk about the investment that will bring some of our lowest paid workers up to $20 per hour at least. So that's really good news. So we want to thank Governor Healey. If you can, go on the MassGov website and look for the contact form so you can reach out and thank her. We want to thank her really from the individuals and families that have been suffering, and thank her from our hero employees that really make people's lives happier and healthier, and really for making this historic investment, which demonstrates her very strong commitment to people with disabilities and to human rights. So just in case you want some possible notes to add. So we're going to cover a little bit of reviewing Chapter 257 increases, the DDS increases. We may talk for a few minutes about the Mass Health fiscal challenges and some of the cuts that were proposed there. And then if we can, we'll squeeze in a little bit of an update on bills. Okay, so I wanted to start with an advocacy timeline just to show everyone like really how long advocacy can take, even when an issue rises to crisis level. In our disability community, it's always an uphill battle. And we started at the ARC kind of sounding the alarm back in 2017 with a workforce white paper. So basically just a deep dive and some research into why we thought there was a workforce shortage and what we were kind of forecasting and what we needed from the administration and the legislature way back then. Our first real ask around the workforce was to increase rates to $24 by 2024. So we aren't there, but we have made some impact. And we did make this our top priority. We filed our first bill about the workforce in 2018-2019 session. But the workforce crisis continued to worsen. And then we got hit with the COVID disaster and the closing of many day programs, which led to, even more loss of staff. So this became really our primary focus with the new administration, with Governor Healey and the legislature. We actually refiled that original workforce bill with some changes that made it a little bit more narrowed to DDS and Mass Health workers. And then we've been working with the legislature on language in the budget that will help us avoid getting cuts related to utilization. So if you remember, the 9C cuts came just a short time ago, and those were related to utilization. So because we didn't have the workforce in place at a lot of these programs, we couldn't bring people back, and the programs could not use the funding the way they would have. So it's sort of a vicious cycle, or a negative feedback loop. And we wanted to make sure that that money that is in the budget and was allocated to that line item is transferable to other line items. So you may hear us talk about that again this year as an important language addition to the budget. We also did some requests for information, tried to gather some data around and names actually to try to identify those people who are still waiting for services after 4 years, or newly engaged people in adult services, those turning 22 who do not have a placement. So we were able to find some of those folks with help from DDS. And we're also doing a campaign called I'm Still Waiting. And it's a very powerful campaign. If you haven't seen it, look it up on our website. And we've collected about 45 stories. They're incredibly powerful stories of people who are really suffering, waiting for services and supports. The individuals are having regression and isolation. Caregivers are really burning out. There's a lot to be super concerned about when you see these stories. So we will hopefully be using them in our advocacy, with permissions. And hoping this helps with our ask this session, which will be around maintaining this governor's budget. But even that is very important to communicate why. Anyway, and then our last step here was the plea that we made to the governor, followed up by the action alert that you all participated in. So again, thank you. So that's where we are now, and we get to review the 2025 budget from Governor Healey. So Governor Healey put $390 million into Chapter 257, which is the line item in the budget, in the state budget, that is the rate reserve for people's salaries who are direct support professionals across all human services. For us, this $390 million is actually looking like it's a $160 million jump from the last time we had a Chapter 257 focused on residential. So if you look at that chart, in 2023 was the last time these funds were directed towards residential, and it's almost $160 million more. But we had an extra added bonus of $95 million that came from the economic development bill, which was actually back in 2022, but this money was set aside particularly for this purpose, to basically enhance the Chapter 257 rates. So altogether, we're looking at $485 million investment, which is almost $500 million for workforce. So this will ensure that median direct care salaries will be no less than $20 per hour. So if you're looking at the chart, that orange color is actually denoting the economic development bill money. But otherwise, the rest of that is straight money for Chapter 257 from the governor. So last year's money went to community day programs. And you can see that, those significantly improved from FY22, but nowhere near what we are seeing this year. Okay, so what does this actually mean for rates? The rates will be affected, as I said, for residential services only this year. It assumes the lowest model rate is no less than $20 per hour. And then the rate review is biennial. So this is we did not review the rates for residential last year. We're doing it this year. Next year, we'll go back to community day programs. And other rates get reviewed as well. In 2023, the funding was $230 million. So as I said, this is a $160 million increase. And again, last year, community day programs did have an impact on, the increases had an impact on our vacancy rates. Okay, so now we're looking at a big spreadsheet of our DDS line item increases. So these are the programmatic and other line items that support people with autism and intellectual and developmental disabilities. And we're just seeing, you know, lots of percentage increases, $134 million in additional funding. And I will pull out a few of these to talk about. The family support. I mean, we're just very, very happy to see $21+ million, which is a 22% increase. And I think this really speaks to the fact that families have really been suffering economically as well when you can't go back to work, when you're caring for someone, you know, more than what a family had expected to do for many years. It can be really challenging. So hopefully those family support programs will really feel the boost, and families will feel that. The community-based day programs had a $58.5 million increase, which is a 26% increase. And these are increases that we're noting from the final budget, which actually had those 9C cuts, if you remember. So this is a pretty large increase for community day programs. And this is partially because of the rate review process that happened through Chapter 257 last year. And we saw that increase, and now that money is there for the staff. So in turning 22, every year we do get typically, we meet our needs for turning 22 through the governor's budget with Governor Baker and now with Governor Healey. This is, again, our biggest class. We had 1,400 last year. We expect at least the same this year. Obviously, transportation works with each of these other program line items. If you have a day program but you don't have transportation, you know, sometimes you may not be able to accept it. So making sure that we are also looking at transportation needs to get people back to services. And again, the autism line items were increased almost $9.8 million for the adults with autism and another $1 million for the children's waiver. And that is some significant increases. For the children's waiver, it will include 75 new families, which is really good to hear. If we can get to some of those children with autism earlier, we know that the earlier and the more intense, the better the outcomes. So they also didn't forget respite and technology investments. I think it was $500,000 in technology, which has been kind of steady every year. And then some special respite programs, again, were funded outside of family support. And then some people will be very interested to hear that $10 million has been set aside for the intensive residential program pilot, actually, that is for complex behavior and medical needs. And so that's we're trying to get a little more information on that program, but we know we know it's much needed. And then this is not related to DDS, I guess I should have put on the screen, but there's some funding for nursing development and continuous nursing as well, which I think will really affect many of our families. If we don't get more nurses into our day programs and residential programs and continuous nursing for those at home, we're really at risk for the health and wellness of the adults and children in our community. So I wanted to talk a little bit about the messaging, because this is the same messaging we were using before the budget came out, and we're going to be using this messaging now. We still have thousands waiting for services. It's going to take some time as the legislature approves this money to hire people, recruit people, train people, and get them into these jobs. In the meantime, we still need to support all these families who are waiting. We know that there's issues with staff who are working overtime, working temporary staff coming in, and this can lead to abuse and neglect. So we still need to really focus on this important messaging so that they do not have any intentions of cutting any of these funds that the governor has put in here. As I mentioned before, we have to avoid that vicious cycle of the legislature makes cuts, and then, because we don't have the workforce, and then we can't hire the workforce. So we have to avoid that. We have to fund it and keep it funded. And this is back to, the I'm Still Waiting campaign. And I know this is a little shocking, but these are the words that came from the word cloud of the 45 plus stories that we collected. Parents are getting hurt. There's self-injury, there's aggression, there's isolation. These words really speak what's happening to those who have been suffering for far too long. Pay scale is so low, was one of them that jumped out. So this is definitely kind of the language that we want to keep in mind, whether it's residential or day program or family support or self-direction. We need this unrelenting workforce crisis to turn the tide. And these are kind of all the reasons why we need that. Okay, so just a quick overview of the Mass Health fiscal challenges. They had to kind of absorb a $1 billion loss of federal funds due to the end of the pandemic. And so with that and still a $20 billion budget, there does need to be, from their perspective, some pulling back and cost savings initiatives, one of them being through the PCA program. So that will affect many of our folks. Right now, it looks like the proposal is to reduce meal prep time, I think from 10 hours to 7. We will have probably another webinar with a mass health advocacy expert that will join me to kind of review all this and the advocacy that may need to happen. Also, it will be affecting people who have less than 10 hours of services altogether for PCA. So, we're really hoping that Mass Health can contain their costs, because we don't want them to then go to the adult day programs to cut anything there, because they're barely getting stabilized. They did get a $200 million investment last budget session, and we need that to continue so that the rates can stay close to $20 per hour and above, and that we can continue to bring people back to Mass Health Day programs. Okay, so this budget that we're talking about, that will be sending out an clear action alert, advocacy ask, and probably some action alerts as well. We know that the budget is now in House Ways and Means, and they do have a chunk of time to review this budget and come out with their version. We're really hoping that through our advocacy, they see the need to maintain all of these increases. But then the budget will go to the House, over to the Senate Ways and Means, which really they're kind of starting over with their own budget from the governor and making their own recommendations. And that will go to the whole Senate. And then the final budget is reviewed by the conference committee, which is half Senate and half House. And then they will come to the final budget that will go back to the governor. So we have kind of a long stretch ahead of us. So it's not that long, it goes quick, of advocacy between the House and the Senate and the conference committee. So stay with us around that. And what we're really going to be trying to do is impact the leadership, right? So when you reach out to your rep and your senator, you're basically telling them, go talk to leadership, talk to your colleagues and others about the need for this funding to remain. The more people contact their reps and senators, the more reps and senators will be talking to these folks who will be making a pretty large impact on our budget, as always. Okay, so what we can do together, I would say if you send an action alert, over the next couple of months about the budget, just always follow up with a phone call. Did you get my action alert? What kind of action can you take? This is very important to me as a constituent, that you follow up with your leadership, and that you support the ARC's budget asks. We'll have some clear asks for you to have. Some fact sheets around chapter 257 are almost ready. And then I would say, maybe now's the time to actually set up a meeting and, talk to your rep and senator about why this is so important to maintain. I think you can do that virtually. You can do that in their office hours. Everyone seems to be back to office hours, and or, get in there and make a day of it. So together with our asks, our messaging, and your story, which is the key piece, I think we're going to be able to do this and get this significant increases through. All right, so I'm going to stop there. And I really appreciate everybody's time getting to understand the budget just a little bit better. There's a lot to understand here, and I'm sure there's some questions for folks that are watching now. So please reach out to me. I am definitely available to answer any questions, and so is Jose Lopez, our new policy officer. So reach out to the ARC and we can help you walk through any of your questions. But get ready to see our action alerts and our asks so you can share them with your legislators. So thanks again and stay well, everybody.